The FDA adds amoxicillin to its list of drugs in short supply. This comes at a time when more children get treated for infections with it. ABC 3340's Megan Scarano is working for you. And Megan, what are pharmacies in our area seeing?
Brooklear Pharmacy tells me that amoxicillin is hard to keep on the shelves and even harder to get in stock. And the timing of the shortage comes just as we head into the colder months.
We've had lots of waves of kids in and out, lots being sent home from school.
Caitlin Walker says recently a lot of kids have been out sick from her kindergarten class. But it's not just students missing from the classroom. There's also amoxicillin missing from the shelves.
And typically here we would have at least 10 bottles of amoxicillin 400 per 5 at any given moment. And so you can see right now we only have one.
Samantha Beck is a pharmacist at Brooklear Health Mart Pharmacy. She says supply chain issues with ingredients and an increased demand for the medication have contributed to the shortage. And it comes at a time when antibiotics like amoxicillin are needed the most.
Anytime we get to the cold weather, the seasons change, kids get sick, they go back to school, and then they come home for Christmas break. We'll see another rise in January when they go back to school.
She says the pharmacy works to make sure no one is without the medication they need.
Sometimes we even have no bottles on the shelf, which leaves us to having to compound or convert some strengths to other strengths. We order every single day. We're trying our best every day to order as much as possible to make sure that whenever it does become available, it's back on our shelf.
For Walker, she's doing what she can to keep her young students healthy.
We are going through some hand sanitizer, all the wiping down, the Lysol spray.
Now tonight, I did reach out to Children's of Alabama to see what they are experiencing with the amoxicillin shortage, and they sent me this statement reading in part, while there are several manufacturers that have announced supply shortages of various dosage forms, liquids, and pills, there is no need for there to be a cause for concern for parents that their children would not be able to get the antibiotic they need when there is an adequate supply and suitable alternative dosage forms available in the community at this time. Live in Alabaster, Megan Scarano, ABC 3340 News.